Hello, everyone. Thank you so much for being on the Edge on Regenerative Medicine show. I just want to say I'm so excited today. We have Dr. Daniel Larsen, DC of rivertownhealth.com. And I just want to say thank you so much, Doctor, for being on the show.
Thanks, Mark. I appreciate it. Glad to be here.
Awesome. I know. I'm sure you're in the I believe the Stillwater, Minnesota area, right?
That's correct. Yes. Yep.
Are you keeping warm or?
Yeah, it's a little chilly here. It's Minnesota, so yeah, we're keeping warm.
As long as you got your hot cup of coffee or cocoa, since Christmas is coming, right?
Right. Exactly.
Right. So, hey, everyone, I'm excited today. We're Dr. Daniel Larsen is in the Stillwater, Minnesota area, and today's topic is going to be a little bit. I would say a little bit of two things. It's going to be on knee pain, and how can knee pain be connected to back pain, which is huge. We're going to be discussing, which will be intertwined with their conversation today. So what I'd love the viewers out there, hey, sharing is caring. And if you could share this, please do so, because think about it, folks. When you're sharing something, even if they're not in your area, so many people fly out to this doctor to get help because he knows what he's doing. So, think about this. You might not be in pain right now, but, hopefully not. But sometimes as we get older and we don't take care of ourselves, in the future, our body starts to wear down. So sharing is caring, like I said. Like it, share it, because you could be helping somebody by this video just being on your page. So I'm going to let you guys know out there in internet land a little bit about Dr. Daniel Larsen. I would love to have him share all the accolades, but you know what? It's so much better when you hear it from somebody else. So I'm going to go for it. So, Dr. Larsen has a doctorate of chiropractic from the prestigious Park College in Dallas, Texas, which I'll be there hopefully in the next couple months. And he is also a co-author of the #1 bestseller book called Health Secret Revealed. So what we'll do is we'll also put his link so you guys can take a look at that book. Also, he is in the advanced certification. He took the advanced certification from the Spine Research Institute of beautiful San Diego, and he is also board certified naturopathic physician. He is also a fellow International Academy of Medical Acupuncture and certified in dynamic range of motion and scan vision. He is also certified in spinal ligament injuries. He has also taken courses with the Trigenic Institute of Functional Neurology and has taken classes from Harvard Medical School. Say that 23 times, right?
Right.
He is also 23 years of practice experience. So I'm excited today to have you guys you on here, doctor, and everybody else here on the show. We're going to be talking about knee. The knee, for some reason, I've noticed just being in this industry, I would say 90% of the people that I know have knee problems. So if you wouldn't mind maybe just telling us, doctor, how you got into this industry and how why you're passionate about knee pain.
Yeah, thanks, Mark. I appreciate that. Yeah, glad to be here. So with knee pain, out there, when you're seeking out treatment for knee pain, there's not much treatment out there. A lot of people are just trying to throw some medications at it, trying to do some stretching. Maybe if you strengthen it, and then maybe if you get injections, that all leads to one thing, and that's surgery. So surgery is the very last thing you want to do. So what I do is I take a different approach. I want to make sure we can fix the knee or heal the knee before you have to go and get injections or before you have to get surgery. So what I like to do is in my office is I like to tell my patients, we like to do surgery without the surgery. So, and we use specialized therapy equipment and specialized treatment parameters to make sure we get that done. Yeah.
Okay.
So,
and how did you get it? Like how did you get in this industry? What was where the light bulb turned on and, hey, I want to do this for the next 23 years or 40 years?
Right. So I was a big athlete, obviously in college, and I still do a lot of athletic events. And my family we're all athletic, and I've looked at different parts of the body, and being in chiropractic, I look at biomechanics, and with the knee, if your knee's going to start to wear out, usually it's a biomechanic issue and a nerve issue. So most people don't know that it's a nerve issue. So that's what causes most of the time the wearing out of the knee itself, not just trauma, but actually it's coming from the nerves in your lower back.
Would you say, I mean, I was a tennis pro, so I love sports. It doesn't matter what it is, anything with the ball. And it's funny because I stopped playing tennis a while back for a while. Now I'm just going to start getting back in. It's been years because I noticed that I see a lot of people when they get older, they start to have really bad problems with their knees because of all the hitting on the asphalt.
Sure.
What would you say that are normally the beginning stages so that people can catch it before it happens?
Yeah. So the first thing that you have to do, the first thing that I would do is you take an x-ray of the knees and the lower back, and then you can see how much degeneration you do have in there. Now, as far as a preventative, is that just basically like you said, if you came into my office, I'd do a full, complete exam, and then I'd take some x-rays and find out where you're at.
Okay. So let's say you're in the beginning stages where you're maybe not in pain.
Yep.
But the graph basically shows on your computer screen, hey, this is where something's starting to happen. What would you normally tell them to start doing so that doesn't happen for the future pain?
Right. So there's a lot of preventative things that you can do. Stretching and exercise is always the best thing. Eating properly and taking care of your joints, supplementation
right,
is good for it. But just to get checked out by someone that actually specializes in the knee would be very important. So for example,
why would eating be a big deal? I mean,
right.
I mean, isn't McDonald's and stuff like that okay? I mean, are you saying is it because of the weight that it puts on, or is it, I mean...
Right. So we know from Mayo has a study that says every pound that you're overweight puts an extra 4 pounds of pressure on your joints. So if you're carrying, each pound is actually 4 pounds of pressure. So that's a lot of pressure on there. And that can, if you don't have proper biomechanics, that can just wear out your knees and joints a lot faster.
Okay, that makes a lot of sense. So let's just say I start working out, and we hear that, muscle weighs more than fat. Is that correct?
That's correct. Yep.
I want to make sure. So let's say I'm working out and I've got all this lean muscle, but if that weighs more, wouldn't that put more pain on my knee?
No, because your body works in a biomechanical system. So you have to be in proper alignment, if you will. So that's why it's good to see a chiropractor to make sure you're properly aligned.
Right.
And while you're going to be doing a sport or, getting back into it, that's very important to make sure you get that checked.
Okay. Let's just say I'm in pain. I have knee pain right now, and it's really bothering me. What would you normally suggest? I know it depends on from 1 to 10 how bad that scale is, but let's just take, just an average person that you work with. Do you see them once a week, once a month? What would you recommend? I know it depends on the scale, but like an average for someone to keep that tuned up with you.
Yeah. So that would be the first thing we would do. We'd do a full extensive exam, make sure we take x-ray to rule in or rule out any degenerative changes. And then from there, we'd make a proper diagnosis and then, of course, a treatment plan. And sometimes I have patients that come in. I do have wellness care or maintenance care. And I do see a lot of athletes that just want to stay on top of the game. They're not necessarily hurting, but they want to have that edge. So when they do play their sport, they have that edge and everything's working better. So usually it can be anywhere from, depending upon the athlete and depending upon if it's, a weekend warrior or a pro athlete that I've seen, I see them sometimes once a week all the way up to once a month.
Right. Okay. Yeah. That's okay. It's kind of like I was talking to my wife recently, I have a small curvature in my spine from scoliosis, and I was telling my wife that she's like, why do you have to go all the time? I go, well, it's pretty simple. We have our body is like a vehicle.
Right.
And what do you do with your vehicle? You rotate the tires every certain amount of miles. You get an oil change. A vehicle's no different than our body as a vehicle. I mean, so that's why I try to go at least twice a month, just for alignment. I just think that everybody needs to, if they would focus more on that, their health is their real wealth, not because you're going to end up spending more money in the long term if you don't start taking care of your body now, especially seeing a chiropractor, someone that's in wellness like yourself.
Yeah.
Do you just do chiropractic? So when I hear chiropractic, I hear you just, crack backs and you're good to go. I mean, how about at your office?
Right. No, that is a main focus because chiropractic. Everybody thinks when everybody thinks of a chiropractor, think of neck and back pain, which is excellent. We're experts at that. We know neck and back pain, but actually, what we are is nerve doctors. So let me explain the whole body and all the organs and all the systems. Every cell, tissue, and organ works and functions from the nervous system.
Right.
So the nervous system controls everything. So if the nervous system isn't functioning correctly, then everything else in your body is not going to work. So that's where we look to the spine, where the nerves exit the spine and they go to all our organs, all our tissues. And so that's the first place I look at it, and chiropractic restores the proper biomechanics. But then we do have a whole host of other specialized equipment in the office to take care of specific things like the knee. I do have a specialized therapy for the knee and a specialized device for that, and also the low back. And I also have another machine that actually regenerates damaged tissue.
Wow.
And then so there's a lot of different things that I am doing in my office right now. Yeah. Yep. Okay. So we go beyond. Yep. Okay,
yeah, and beyond. A little bit of Buzz Lightyear right there.
Right.
So I know that you and we've talked a little bit, and you were telling me how you've had quite a few patients, that you've worked on with their knee, how they've actually have asked you, you were saying that they're asking, why are you looking at my back instead of my knee? The pain is right here, but you're looking at my back. That's very interesting, because I've talked to a lot of doctors and I don't hear that. I hear they go right to the knee.
Right. So just like I said before, is that the whole body's run off the nervous system and the nerves that come out of the spine. So right down in your lower back, right above your tailbone, it's actually called your sacrum, but right above your tailbone, you have 5 lumbar bones, and your L4 and L5 lumbar bones, there's nerves that come off of there, and those are your L4 and L5 nerves. Now those go down your buttock, down your back, your hamstring, your thigh, and they control the muscles and everything around the knees. So actually the lower back, the nerves that come out of there, control everything around the knee. Okay. Now if around the knee, if those muscles and tissues and everything that is not working properly, the knee is going to wear down. And so we have this thing called the synovial fluid pump inside the knee, which the synovial fluid actually bathes the joint capsule and everything in there. And if that pump is not working properly, let's say it's working at 20 or 30%, your knee is also going to wear out faster, and we call that degeneration or arthritis.
Wow. Okay. Pretty scary. That's where I come along.
Yeah, exactly.
So what would you say, what are other alternatives?
Yeah. So, a lot of people out there are probably pretty familiar with, hey, I'm just going to go see my regular doc and he's going to give me, let's try muscle relaxers or sometimes painkillers and, exercise it and stretch it. And usually that doesn't work, and they come back, doc, it's still hurting. Well, you know what? Let's do some injections on it, and then we don't want to do more than 3 injections within a 6-month period of time, because those injections actually start eating away the joint, and that's not good. So, and I've heard from many MDs. In fact, I was just at a seminar in Foxborough, Massachusetts, where I was with a bunch of podiatrist, and they said injections basically don't work. Now, that's not out of my mouth. That's out of theirs. So the injections we know don't work. So that's what people are kind of used to, the alternatives. And another thing, too, is if you go out there and try and exercise, or you want to strengthen the knee around there, is that if the nerve flow from your lower back is not properly getting to those muscle tissues, you might be strengthening them in a bad position. So biomechanically, if you're not correct, you're just going to cement in the bad position. Does that make sense?
That makes a lot of sense. Wow.
Yep. Yeah. So you're working on, so gravity is working against you every day. So we know our bodies break down every day. They're degenerating. So we want them to break down less faster. Okay. And that's what I do. I want to make sure your quality is better than your quantity.
Awesome. I've got a really good question. I got a really good one for you. And it's one of my favorite questions to ask doctors is, in your area, what separates you from the other doctors?
Okay, so when someone comes in and they do have a knee issue, of course I have to rule out a meniscal tear, any other type of, condition that needs appropriate care. Like I will send some patients out to a specialist, an orthopedic specialist. I send patients to get an MRI or a CT scan. I like to rule out different things. So what separates me is that I have the treatment and the therapy equipment, the specialized therapy equipment to actually fix the knee, get the synovial fluid pump working better again, and get you adjusted, and therefore your body's going to heal itself and it's going to get strong that way. And then you can play. Right.
Hey, it's all without pain. It's all about this synovial. What is that?
Synovial fluid pump. Yeah.
Imagine if you were named. That was your name.
Right. Yeah.
Hey, synovial, come here.
Right. Exactly.
Okay. It's interesting. Everyone, I just want to let you know that how I got into the chiropractic industry and working with neurologists and regenerative medicine doctors. I started using the products not just on myself, but also on my loved ones, my family. So my mom and my dad, they're baby boomers, and I'm seeing them in a lot of pain. And I've been blessed to be with doctors like Dr. Larsen here and utilizing a lot of these tools on my family. And let me tell you guys, it works. I wouldn't be doing a show every week if this does not work. I'm passionate about this because I'm sick and tired of doctors out there, so-called doctors, giving you a prescription just to give you another prescription, to give you another prescription. And when it works for a little bit, your body needs something higher. And that's not how to heal the body. Everything starts, my friends, in the spine. That's one thing that I've learned. And everyone, call Dr. Larsen. The phone number's on the screen. And we have people that travel far away just to see him because he gets the job done. Anyways, Dr. Larsen, thank you so much for being on the show. And just thank you. It was a blessing.
Mark, thank you so much. And thank you for having me. I really appreciate it. Thank you so much.
Oh, yeah. Now, everybody go call him and go like his page on Facebook. We'll have his link on here. Anyways,